Health policy and politics. Get involved!
Nurses' involvement in health policy and political action. What is policy?
How is the health policy developed?
Health policy and regulation, a key connection. Health policy and politics, another key connection.
Grassroots political strategies. Get involved on a local level and vote in every election.
The American Nurses Association and current health policy issues.
Today we're going to talk about chapter 23, and it's about health policy and politics and how we can get involved. So first, let us begin by defining what is healthcare policy. Healthcare policy is a set of actions undertaken by government or healthcare organization to obtain a desired outcome. So what does that mean for us? Who makes these policies? How do we as nurses play a role in these healthcare policies? Can we change things? Or is it the government that has to make the changes? So have you ever wondered how your policy at your hospital is made? Is it made by the manager, by their manager, or is it made by the local government? The government is involved all the way from the federal to the state to the local level and up to or down to the hospital level. So in cases where you see policies in a hospital, the hospital has to adhere to the local government and the local government has to adhere to the state government. Aside from establishing policies, healthcare also involves payout. How certain procedures are paid, how certain staff is paid, how doctors are paid. And we as nurses need to take a role in that as well because we, in the long run, are affected as well. The Patient Protection and Affordable Care Act was signed into law in 2010. And since then, there have been many changes to healthcare. One of those changes is how medical staff is paid, how we as insurers pay for insurance and how much it costs, and how insurance companies bill, including Medicaid, Medicare, and CHIP. Another thing that is taken into consideration is patient safety. How patients are taken care of will affect how that hospital or that clinic is paid. National attention on nurses and nursing staff has increased since this passing of the PPACA Act in 2010. And it will continue to impact nurses. And so we as nurses and future nurses need to understand how this is going to affect us.
How is health policy developed? The development of health policy occurs in three ways according to the book. First, enactment of legislation and the accompanying rules and regulations that carry the weight of the law. 2. Administrative decisions/directives made by various governmental agencies of the executive branch. 3. Judicial decisions that interpret statutes, regulations, and settle legal conflicts with society. There are several groups that are involved in the development of health policy. There are elected officials of executive branches, governmental agencies, health-related experts, citizens who can be affected by health problems, stakeholders, and special interest groups. At a state level, SNAs of the ANA are the policy voices of nursing professions with state governors and legislators. Health policy development involves the executive, legislative, and judicial branches of government. The different roles that branches have in the health policy are shown more in depth on page 410 in table 23-2. The development of health policy takes steps to take a health issue that is a societal problem to an actual health program that is funded, implemented, and evaluated. The legislative process is fundamental to the movement of public problem to a public solution. There are many problems in the healthcare field, but only the problems that will attain policy situations are the ones that are brought to the attention of a policymaker who is willing to take action through legislative, regulatory, and funding processes. Normally, the policymaker are approached by interested individuals with a problem or a suggested policy option. At a federal level, only members of the Congress can introduce legislation. The congressional member who introduces a specific piece of legislation becomes the prime sponsor of that legislation. Once a bill becomes a law, implementation falls into the jurisdiction of one of the departments under executive branches of government. According to the book, in 2009 and 2010, 10,621 bills were introduced, but only 383 of those actually became public law. At the federal law level, most health-related policies fall under the jurisdiction of the U.S. Department of Health and Human Services and its related agencies. The agency that will administer the law develops the regulation to implement the law.
Many people are unaware of what policies are in act and who makes those policies and how it affects them. So we decided to ask a few students here on campus what they knew about healthcare reform, policies, and what they can do or others can do about it. So let's listen to see what they have to say. And how do you feel about Obamacare?
I feel like it did nothing to solve the problem on the grand scale.
Really, I don't know much. Haven't really been informed much about it.
Noelle, what do you know about Obamacare?
Well, I know a little bit about it, and it's doesn't it cover for elders? I think so.
It does cover help for elders, yeah, that is true. How do you feel about people that are uninsured?
I feel like there's something that needs to be done about it because when those people get sick or hurt, they need help and they go to the hospital and we pay for them through our higher insurance rates.
And how does that affect directly though? You say it raises our insurance rates, but how is that?
Because they can't pay the hospital and the hospital has to make up the money somehow. So we either make it up through our tax dollars or our insurance.
And could you tell us, who do you think makes the healthcare policies?
I'm guessing that the government. I don't really know.
Who do you think makes these healthcare policies?
Washington.
Do you think any medical staff or nurses play a part in these policies?
Probably, maybe, hopefully, but not as often as we'd like, for sure.
So you think they should play a greater role in the policies?
Absolutely.
Okay. Do you think that there is any medical staff or nurses that play a role in these policies?
I think that there should be, but I don't know if they do.
Who do you think is in charge of healthcare policies?
The government.
Okay. Do you think the government should be the one in charge of making healthcare policies?
Yes and no.
You say yes and no. Why do you say that?
Well, yes, as they should be in charge, but also people should have the right to vote for it. Also, like, make their decision or put in what they think about it.
Are you all familiar with the health policies that are made?
Kind of. Obamacare.
Okay. And who do you think makes these healthcare policies, or who's in charge of Obamacare?
I'm thinking the government.
Okay. Do you think the government should be in charge of your health?
In a way, yes. In a way, no. I mean, it has its goods and its bads, but yeah.
Do you think that nurses and doctors and medical staff should be in charge of healthcare reform, or the government?
Well, that's a little tricky because if doctors are in charge of it, then, I mean, as we can see in class, like, they can raise the prices for, like, consults and stuff like that because they're the ones giving them. But then also if the government does it, then they're not really sure what's going on with the people. So I think it should be a balance between the two and also the patients.
If there was something that you would change about healthcare or insurance as a whole, what would you do?
Probably make it affordable. Some people do waste a lot of money, and it's very expensive.
Do you have insurance right now?
Yes, I do.
And do you think that it's affordable?
Well, for me right now, yeah, I'd say so, but
Is that because you're in school and you pay it through the school?
I don't pay through the school.
Your parents pay for your insurance?
Yes, they do.
Okay, so if your parents didn't pay for your insurance, do you think it would be affordable? And how much would it be?
Probably not.
And do you think that health insurance is affordable?
If you're employed or in the lower economic status, yes.
For you personally, is it affordable?
only because I'm employed.
Given that you were not a student and say you were unemployed or self-employed, do you think that health insurance is affordable?
No.
No. How much?
The book states that regulatory arena is an important but often overlooked area of policy that significantly affects nursing practice. If nurses have an understanding of the regulatory process, then they can gain knowledge that can help them have a more successful influence on the future of nursing. Let's start with what regulation is. The book states regulation refers to the written set of rules issued by the executive branch agency that has a responsibility for administering a law. Oxford Dictionary plainly stated regulation as a rule or directive made and maintained by an authority. Regulations carry the force of the law, so they should reflect the intent of the law as enacted by the legislative body. The book stated that it cannot be overemphasized that supporters of a new law must be vigilant and involved in the development of rules and regulations long after legislation has been passed. This is done through public hearings and that interested individuals can comment on the regulations with input on what should be added and taken away. This is where nurses can play an influential role by attending and speaking at public hearings or writing to the regulatory agency itself. Each comment that is received about the regulation must be considered and responded before the final regulations are issued. Proposed regulations are published on the Federal Register, which is located online, and is the best place to find information about proposed regulations or changes to regulations. It is also printed each day with directions on how to send in your comments and the things that you want to be changed or your input on what should be done with the regulations. Right now, a popular topic that is on the news and everywhere is politics. The presidential elections are coming up, and politics is related to the health policy. There are different ways that political influence can be achieved through campaigns, knowledge, talents, information, and data and relationships. And there are many other ways too, but that's just a few to list. It's through effective political action that nurses can influence the legislative and regulatory decisions that develop in health policies and have more effect on Americans' health in a positive way. As we all know, when we first started nursing, we learned ADPI, and the first part of ADPI is assessment, and that's where you kind of get the foundation of what is going on with your patient and what their issues are or other factors that influence their health. The same thing goes with political policy. As nurses, we gather subjective and objective data through our assessment to then later move on to get our nursing diagnosis, which is the second part. We analyze the information that we have found that's going on with our patients to then have a nursing diagnosis to really figure out like what is going on with the patient. And also political policy does the same thing. They take all the information that about the issues and they analyze it, and like we do with our assessment, to then find a policy solution, which is, and with our ADPI would be a diagnosis. After we have a nursing diagnosis, we can then move on to a nursing plan, which is where we figure out where we want to go with the nursing diagnosis to have positive outcomes. Also with political policy, they need to look at the different perspectives, positive as well as negative outcomes that can happen, preferably positive outcomes to come out of stuff, but then to make a plan so that implementation, which is the next part of the nursing process, can take place. So as we go into implementation, we then come up with different things that can be done to get that positive outcomes that we want. And so as in political policy, they come up with different ways to get the, outcome that they want.
So then the implementation part is just what the nurses can be doing better, what hospitals and different things in healthcare can do better so that they can have positive outcomes. And at the end, of course, at the end of our ad part, we have evaluation where we have to go back and look at the different outcomes that have come out of stuff and where we want, what was positive, what was negative, what should we take and begin to further use, and what can we, if it was a negative outcome, why was it negative, and going back and reevaluating. Nurses definitely need to be more aware of what is going on and the issues that are out there, looking at the regulations that are being put up in on the federal level and on the state level to see what is happening in nursing, and so that you can have your voice be heard if you are passionate about a specific area, to help that process. If we look at it like the nursing process, it's something that we do all the time with the hospital. We can then go out and help to make patients' health better and make nursing better and healthcare better overall.
Okay, grassroots political strategies. What is that? That's getting involved on the local level. The first thing that you can do is actually register to vote. Then vote in every election possible. What we can also do is start town hall meetings, voice our opinions, find people that are in the political arena that we can tell are healthcare issues too, because the majority of politicians, they don't know the healthcare issues that people struggle with like we do, like we see every day. What you can start off by doing is email, fax, get a letter writing campaign going to your local candidates and push the issues that are really close to your heart. That's really and truly what the grassroots level is. It's getting a group of people who are concerned about something and striving to make a change in a positive way. Also, another good option is to join one of the professional nursing organizations, the ANA, for example. They have people that fight with issues that concern us, with concern patient care and safety, that they send their lobbyists to Capitol Hill to fight for people like you and I. Did you know that most political candidates know nothing about health-related issues? They're more involved with the things that they see, and so it's most beneficial to us to start voicing our opinions loudly, because if they don't know that there's something wrong, then how can they fix it? It's up to us as nurses, as student nurses, to join in a coalition to get things changed for our patients. Personal visits to policymakers make a difference. Do you see the educators loading buses every single year to go down to Capitol Hill? Why can't nurses do the same thing? They're looking for better ways to get more funding, to get better books for the children. Why can't we step up, get on those buses, go down to Capitol Hill, and do the same thing, lobby for our patients?
There are several healthcare policy issues today, including healthcare reform, healthcare safety and quality, and the healthcare workforce. Access to quality care and the ability to obtain and maintain affordable health insurance is probably one of the most significant problems that we have in health care today. In 2010, 49.9 million Americans were without health insurance coverage for a full year. Lack of health insurance is the greatest barrier to accessing healthcare services and has a huge negative effect on people's health. More than 50% of the uninsured have no regular source of health care, meaning that they have no primary care doctor to go to when they do have problems. Uninsured individuals are also 4 times more likely to delay or ignore needed care, resulting in conditions being diagnosed at a later stage, and it'll probably be worse worse off diagnosis. Uninsured individuals are less likely to receive preventable care services and are more likely to go to the emergency room for non-emergency care, which is neither cost-effective nor clinically effective. More than 60% of bankruptcies in the United States are related to illnesses, medical causes, and medical debt. The ANA plays a strong role in influencing healthcare reforms. The ANA also provides information for nurses to stay current and become involved as healthcare reform moves toward implementation in our country. Nurses need to stay alert for new and proposed legislation and its amendments that will affect nursing care, patient safety, and healthcare quality.
Health policy and politics. Get involved.